Welcome back to my channel. It's your girl Teresley, and as you can see from the title, we are talking about questions people fear to ask. In the house, we have a guest, and I will have him introduce himself. So, karibu sana. Unaitwa nani?
Thank you very much for having me in your show.
Mm-hmm.
Kwa majina mimi naitwa Zakaria Machari.
Mm-hmm.
Professionally, mimi ni daktari wa dawa. That is, I'm a pharmacist.
Yeah.
And what we call community pharmacy. Pale yule mtu unapata pale kwa dawa anakuhusia, unamwambia shida zako, anakusort.
Yeah.
Yes.
Okay, thank you so much for accepting my invitation. And no sentence, this is a normal conversation. Kama vile tuko na maswali 10 na utaweza kutujibu.
Yote tutang'ang'ana, tupambane na tuone vile iko. Yes.
And our first question is there something like condom burst?
Hiyo kitu iko. Condom burst.
Niko.
Vile tu naisema. Condom burst. Basically, this is where once you are having sex and you have put on your condom, it bursts unintentionally. Yani hutaki ipasuke. Lakini inapasuka.
But some people can do it intentionally.
Kuna wakora. Some people may not feel good when you're having sex with that thing. Wanaita kukula kwa sweet. So, kukula kwa sweet. All they do you just tear your finger. Alafu nakwambia kamepasuka. Lakini basically,
so it's easy to pasua.
It's very easy. Okay, not that easy, but if you want to pasua, utaipasua.
Yeah,
and it is very risky, by the way. It's not good to have that experience because as soon you don't know your partner, chances are kama ako na HIV
unapata.
Unaona sasa?
Kama ni mimba unapata.
Kama ni mimba unapata. Sasa unaanza kulia hapo ati ni wewe tu. So it is there.
Yeah. So our next question is UTIs in ladies. What is this?
UTI in ladies.
Inaweza kuwa kwa men?
Men hata hao wapata na hii kitu.
Ni infection?
UTI basically, UTI means urinary tract infection. This is infection of urinary tract system.
Oh, so it can be.
It can be in male or female.
I thought it's only in ladies.
No, even men do have. That's why it is transmitted. Unaona, unachukua kutoka kwa wife, unapeleka kwa bwana hivyo. So, but basically inaweza kuja kutokana na saipata kwa njia nyingi. The first thing is to define what's a urinary tract infection. As we have said, it is the infection in the urinary tract system. And urinary tract system comprises of many things. Kuna kidney, kuna utilize, kuna bladder, kuna urethra.
Hizo zote.
Sawa. So it can be upper urinary tract system, which is kidney, and it can be lower, which is bladder and urethra. But in most cases, inakuja kwa lower urinary tract system. Yes.
The symptoms, are they the same in men and ladies?
Basically, it have, okay, for ladies, kwa kawaida, hizi symptoms inafanana because there is itchiness, there is pain urination, there is continuous urination. Yani unaenda unakojoa, alafu ukifika pale kwa kiti unasikia kama imeisha. Unaenda kukojoa unapata kametoka kidogo. That's how ina behave. But still unaweza kuwa na discharge, which can be yellowish or scarlet.
Hainuki?
Hiyo ya infection inanuka. Lakini pia si necessarily sex inakupelekea upate na UTI. You can also get it with those people who have diabetes, those who are immunocompromised. They have like diabetes. They have high chances of getting urinary tract infection. There are also those people who have what we call call inability to empty their bowel. Bowel incontinence. And who inability to empty their bowel. Bowel ni yani choo kubwa yani inakukalia kidogo. That's for ladies.
Guy.
We can also have this.
So inability to empty.
To empty.
To empty ni?
To empty.
Kwenda choo. Kwenda choo. Yes. Guy. There is such a problem.
Yes. So there are so many things zinaweza kufanya upatwe na UTI.
Okay. That one is a serious one.
Kwanza shida ni pain. Pain ndio baya. Na kushindwa kukojoa. Bowel incontinence is a situation where you are not in a position to hold the bowel or the stool. Yani choo inatoka tu bila kupenda. Unajipata kama kujikojorea tu. Kama vile unahara. Unaona? Kienda hivyo tu inatoka hivyo. Yani you don't have, your muscles are not as strong. Hazihold. So unaona ikiflow itaenda kwa female organ ya reproductive organ alafu ilete UTI.
Can it be cured?
Yes, it can be cured. Every condition here is treatable.
That's one is a
bad one.
That question is, these drugs that are called PrEPs, when do you take them? For how long? When are you supposed to start?
Here we are talking of two different things. There is PEP and PrEP. Let us start with the PEP. PEP means post-exposure prophylaxis. Yani ushaingia, ushamess, unaogopa yule mtu mmelala naye akona HIV. Now utaki HIV kupate. That's what we call PEP because it's post.
So you want to prevent.
You want to prevent. Already ushaji exposed, you want to prevent. That one, you are supposed to start it before 72 hours are over. Yes, since the time you are, since the intercourse of the time you are exposed. And basically you are supposed to take for 20 days. That is 1 month. Yes, 20 days. That is 4 weeks or 1 month. Fairly free.
How many times per day?
Itategemea. There are different regimes. Kuna dawa tofauti zile unataka. But the most common one used unatumia once per day. Once per day.
Just once.
Just once. Most preferably asubuhi juu kuna tushida tungine za kufanya usilale. Yes. Effects. Yes, side effects.
Side effects ndio.
Naweza fanya usilale. So it's normally a device you take in the morning. For 28 days.
What about that one? The other one?
PrEP now is pre-exposure. Hii unajua wewe si mtu mzuri na unapanga kutoka nje. Sasa unakunywa hii dawa ili usipatwe na HIV.
Kimaramari.
Kama wewe ni kimaramari, you take this. But this one is not that easy to get it. There is a program in the government hospitals whereby all those people who are at risk wanakuwa enrolled. Just like there is those people who have been enrolled for HIV. Now you are supposed to take this drug continuously until you change your behaviors or else your exposure decreases.
At those people who are at risk. What do you mean by that?
Risk, and if there are 3 categories of people who normally or who are supposed to take PrEP. One is commercial sex workers. You know, they don't know their partners status zao na si lazima partner acomply na conditions zake. So it is good to be on PrEP to be sure even if she engages in unprotected sex, ako sawa. Yes. The other category is those people who the drug addicts, especially wale wa Mombasa wanajiduganga huku kwa mishipa, unaona? So they do share those needles. Yes, and you don't know how that patient is, that client is. Yes. So utajipata umejidunga hata haijapoa unadunga wewe mwingine, so chances of transmitting this HIV is very high. That category are drug drivers. Wale wa Mulolongo, unaona, na Busia. Truck drivers. Truck drivers. Hawa ni watu wako na risk. Sijui, lakini nasikianga they have have many wives along the path.
During
Kutoka
their
Mombasa
travels.
mpaka Zaire shwari, hata wewe ungekuwa mtu unaweza kaa bila.
What about
wanawekwa kwa hiyo.
What about those kids who are born by positive parents, young kids? What are they given?
Those they are in different category. It is called as a government program, prevention of mother to child transmission.
What if si ameshazaliwa na mamake ako positive na amenyonyeshwa? What are they given?
They are put. Okay, that one cannot be called PrEP.
That is not PrEP.
It is not PrEP. That's not PrEP. No, it's not PrEP. Because PrEP is for those people who are engaging in those activities which can expose them to.
So that one is a different one.
This one is not PrEP. And that they have a different regimen. They are called regimen. Then they have different drugs. Wanakunywa dawa tofauti au watoto. What normally happens, mamake lazima akuwekwa ARVs. Yes, and once you are on the ARVs, chances are your thyroid has been reduced to negligible. Unaona, such that hata chances ya kutransmit haiko very high.
Yeah, you sure?
No chances. That is, we are talking about probability. And when you talk about probability, maybe 90 to maybe 1. Unaona? And that's why when this kid is born, is also put in a treatment
for a duration of
6 months.
So our next question is safe days. Do they work?
Safe days do work. Safe days do work. But the big question is, what are safe days?
Yes. What are they?
Where to be labda unajua.
Me, I don't want to risk.
What do you understand by safe days?
They are the days that you cannot get pregnant.
Yes.
Yes. That the days that you are not fertile.
Yes. Basically, that's what is called safe days. These are days.
How many days are those?
We don't have a definite or a standard safe days, because actually you are supposed to calculate the most fertile days. You minus them from the less fertile days. Now those which are less fertile, or not really less fertile, but those days which you cannot conceive at all, they are called safe days.
So identifying them is a problem.
Yes, that's a challenge to many people, but it is very easy. The first way, or the first way to identify them, you start counting ile siku umereceive mara ya kwanza. Let us assume your period menstrual cycle is regular. Regular means it comes after every 28 to 32 days.
They are
28 to 32 days. So that is regular. So you can be able to be sure that your ovulation now comes at 14th day. Are you together? So to start calculating safe days, you have to start the day when you have received the first menstruation. Tuseme ulipata first tuko November.
Yeah, we are that till.
We are that till. Okay, let us start with December. Tuseme umeanza kuona, you have started receiving your flow on 1st December. That is the first day, and that's a safe day.
But
it's a safe day.
It can be disgusting on a
unajua sasa hiyo ni shughuli yako.
So when you start receiving, how many days are there?
Then,
safe days. How many safe days are there?
Safe days. The first thing you do is that menstruation occur at the 14th day. So at date 14, that's when you are going to menstruate, and not menstruate, but to ovulate. Are you together?
The 14th day is the ovulation day, when you are fertile.
Yes. Or when you have the regular menstrual cycle. So in this 14th day, ovulation can be 4 days earlier or 4 days late. So take the 14 days, you minus 4 days. So even on 10th, you can still have menstruation. No, ovulation. No. So these on men, they are not safe. Then from 14th day to 18th day, they are also not safe. So how many unsafe days do you have there?
20.
8.
Each side.
Yes, 4.
Or unsafe days
unsafe.
are 8.
Yes, if there are 8. So it is 4 from the 14th day.
From
and
this side.
4 after the 14th day.
Yeah.
But here comes the catch. Sometimes you don't know how your body behaves.
Yeah.
So menstruation can start at the 8th day instead of the 10th day. So it is important to avoid safe days in the first cycle or in the first 14
days. Yeah.
Yes, unless you are
sure.
No, unless you're breathing. No, when you're breathing, you are sure you cannot conceive. So they are safe days. So immediately after breathing, for sure, that one inaweza kumesha. But if there are people or there are ladies who normally knows when they are ovulating
because of the
pain which comes, it can be at the left or at the right.
But someone once told me that it's not the exact date.
It is not the
when you calculate, they are not like the same. It's not like the 14th day.
There's nothing like 14. Normally is hours. It's not country. So you cannot force God to use your number. That's why he's talking about probability. You get my point? So say this, basically now you should calculate after the 20th day. Hapo tumeshikana? Ama hujaelewa kitu?
I got it, but I don't want to risk. Yeah. So our next question is, does size matter or height during sex?
That is very, very hard to answer. It all depends on the recipient and the giver.
So according to you men, does it matter?
I can't say in general to ask men, but me, I can say according to me, I don't think it matters. Because according to psychologists, sex is all about your head, kichwa yako. Ukiona mtu, una-arouse.
I know. It matters. I think it matters.
How? Explain to me how it matters. Because, we are asking questions which are not asked. Now,
just to know it matters to us.
Ladies.
Yes.
How?
How do I explain?
I don't know. We are telling you. How does it matter? I'm
among those people who don't. I don't feel like.
That is it.
I don't know how to explain.
I have an advice. If there is a problem, it's good to see a psychologist.
A psychologist.
No. Can be able to.
It does matter. There's nothing like at what? It's
all about
psychological matters. Psycho. You want us to go?
The psychologist. Because sex is all about head. That's what they say. If your head, even if you have let me not details.
Let's leave that one. Next one. Do guys only think about sex?
No.
Like when you see a curvy girl, a beautiful one. What is your first thing you mean when you see that?
Hiyo ni kali juu itategemea. But majority of men, especially who are not bound by the religion.
Religion?
Yes, religion.
What do you mean by that?
Religion, there are people who are saved. There are Muslims, there are Hindus. And
Muslims are saved?
No, I'm saying there are those people who are Christians and they are saved. We have Muslims, we have also Hindu, and we have even the African culture. These people, I'm talking about these people, they prescribe to their religion, and the religion, it has its limits. But basically 80% of all men when they see a chick, atafikiria hiyo kitu tu. Hiyo ndio
So we are not safe.
You have safe. You know, hii ni kitu kufikiria ni tofauti na kufanya. Unaona? Because still in that 80%, 78% they can't rape, obviously. They can decide, but 2% can't rape. Remember. So
you want to say it's a desire?
It is a desire.
Just a desire, but no action.
It's just a desire. It's just about when you come down to the religious side, that's an action. A desire and action is the same. But when you come to African and the rule of law, kukula na macho si vibaya na
Jesus. The other one is, what causes penis pain in men? You know, there was a guy who once told me, nilimuuliza, unaumwa na wapi? Kaniambia, naumwa na mkojo. Mkojo unauma. Mkojo inauma.
Haiwezi.
But after talking to him, he had unprotected sex. So maybe they were in STI.
Maybe it was either STI or UTI.
Infection.
UTI. Basically, when these people, when they are expressing what they are feeling, they say, "Amwana huku chini." Now you have to go ahead and ask, chini gani? Huku tu. Unakojoa. Unaumwa. Now it's upon you, if you are a doctor or a healthcare giver, to interrogate more. You hata kuambia anaumwa na wapi exactly. So you interrogate more. Atamuuliza mkojo iko namna gani. So now when you mention these words, they just relax and they open up. Sasa anaweza kuambia nikikojoa naumwa sana, halafu ama niko na blister on my penis. But also have a blister on my penis. And these are things which require medical attention. That one requires medical attention. So it's upon the healthcare giver to decide the way forward for that
specific person.
Yes. Lakini wanaume wanaumwa na penis.
Our next question, do men get heartbreaks?
Anyway, people do get heartbreaks because ara tukiwa kwa madawa, you see many patients coming complaining, they have kitu moja wana complain, they have what we call stress. Stress ni ya nini? Wanaanza kuambia sijui wife yangu amenifanyia, penzi wangu amenifanyia. You know, that's a form of heartbreak. Okay, if you interrogate them more, you realize they have been disappointed by their loved ones. Na hiyo ni kali. Hata hiyo stress juu ya mesa sa maombi ama ende kwa counseling. Otherwise, men are also human beings. They also have heart. Kwani yao ni ya chuma. Nikiwe.
Simula kuwa heartless.
Bana. It's just a small person. Just vile nyingi pia masri kids wanakuanga heartless. Wanamaliza wazee.
So we are done with the questions. So thanks so much for coming.
Yes. We
appreciate. And if you have questions, comment in the comment section and he will get to answer them. So see you on my next video. Bye bye.